Hello, my name is Jess, and today I'd like to talk to you about bilharzia, what it is, how it affects people, and how best to prevent it. So, bilharzia is also known as schistosomiasis. It is a parasitic disease caused by waterborne worms that live in subtropical and tropical regions, most notably in Africa, though cases have been observed in South Asia and South America. 90% of bilharzia cases are observed in Africa and is the second most common disease in Africa after malaria. In South Africa, 1 in 4 people are infected every year. Infection occurs after contact with water that the worms live in, and worms stick to the skin and then burrow through the skin and into the bloodstream. Bilharzia is a disease that can exist in the body without any symptoms for many years until significant damage has been done to the body. This is one of the reasons bilharzia can be so difficult to detect. When someone does experience symptoms, they can present as either acute symptoms or chronic symptoms, and these symptoms will depend on which parts of the body are infected and how sensitive the body's immune response to the eggs is. Acute symptoms can include fever, headaches, muscle pain, diarrhea, and trouble breathing, whereas chronic symptoms can include tummy pain, diarrhea, or constipation, blood in the urine or stool, and difficulty breathing as well. Acute symptoms can present in 2 to 6 weeks, and chronic symptoms can present at any time after infection, but typically after a year or more. Acute symptoms may never present, and chronic symptoms may not present ever. The life cycle of bilharzia begins when eggs are shed from infected humans in bodily excretions. These eggs hatch and seek out an intermediary host in the form of freshwater snails. These develop into free-swimming worms, which leave the snails to seek out new hosts in the water. Once the worms come into contact with a new host in the form of a person or another mammal animal, such as goats or cows, they stick to the skin and proceed to burrow into the bloodstream, which they use to travel into one of the organ systems of the body, often the bowels, bladder, or liver. Once mature in the body, the worms pair off and breed, releasing eggs into the body to be excreted. This triggers the beginning of the life cycle once again, and in this way, the life cycle can perpetuate itself because water can be cleansed and humans can be treated, but they may continue to reinfect each other over time, especially if a large human population exists around a freshwater source. There are a few preventive actions that can be taken, but today we'll be focusing mostly on water safety. All freshwater sources should be considered suspect unless they are confirmed to be safe by the local government. To confirm if a freshwater source is clean and safe to go into, you can check with the local health department or online. If you do not know for sure that the water is safe, avoid contact with the water for any domestic tasks and recreational use. It is especially important to keep small children out of potentially contaminated sources, as they suffer the worst long-term side effects from the illness. If tap water is not available and fresh water is the only source for domestic tasks, boil the water for 1 minute and allow it to cool before using it. This will eliminate any potential pathogens in the water and make it safe for use. If accidental water contact does happen and no preventative cleansing has taken place, you can pat yourself down with a towel firmly. This may prevent the worms from sticking to the skin and dislodge them before any infection can set in. However, this has not been proven to be entirely effective against stopping the worms from taking root. And that brings us into our next section, which is treatment and preventative treatment. If you are worried that you may have bilharzia, you can visit your local health clinic. A nurse or a doctor will give you an examination, and this will most often come in the form of a physical exam and a recent medical history. There are tests to confirm the presence of bilharzia, but they are time-consuming and often unnecessary. If you are showing concerning symptoms and have been at an at-risk area recently, you will be given a single dose of the medication that is used to treat bilharzia. This medicine is a single pill that clears the parasite from your system within 24 hours. Side effects of this medication may include a mild fever and some digestive distress. This should be effective after 24 hours, and the parasite should be cleared from your system. This is effective in 90% of cases. However, in the event that the parasite is not cleared after the first dose and symptoms of the parasite persist, a second dose will be given after 4 to 6 weeks. And this is a process that can be repeated yearly for anyone living in at-risk areas. All right, so that's the end of our presentation. Thank you for joining me today, and I hope you found this very educational.